Hi, I'm Dr. Joanne Hoffman, a pediatrician at South Lake Pediatrics. At South Lake Pediatrics, we work hard to help our patients by providing educational opportunities for their busy parents. Our parent education program continues today with a positive presentation from Ashley Crist, a social worker with PrairieCare who likes a holistic approach. She also offices right here at South Lake Pediatrics. Ashley's experiences include clinical and school-based therapy and private practice. She works with youth of all ages and specializes in play therapy, patient strengths, and cognitive behavioral therapy. Ashley's talk is a nice complement to the video by Dr. Katie Holter, also on our website. Today, Ashley's going to share her insight on the size and scale of feelings. Welcome, Ashley.
Thank you, Dr. Hoffman. Hello, everyone. I'm so happy to be here today talking to you about the big feeling idea. Often one of the first things that I tell patients and families when I see them is that all feelings are okay. We all have feelings, from our youngest children to teenagers, to our parents, to teachers, to doctors, or even therapists. Our feelings have important jobs inside our brain telling us what is going on around us. It is important to listen to them. The challenge becomes when a certain feeling becomes too big or we get stuck in a feeling for too long. Then it is important to recognize the feeling and to work to cope through it or make it smaller so that we can keep doing the things that we need to do during our day. Big feelings do happen, and they can also tell us important information, but it's also about how we show or express our big feelings that can sometimes become challenging. For example, having a big anger as a child is okay. However, if that anger is creating destruction of property or potential harm to self or others, it is time to intervene and provide other healthy outlets. Providing children with ideas and strategies of how they can better show their big feelings to others can help ensure healthy coping patterns are being developed. I hope that today I can provide more tools to be able to recognize the size of our kids' feelings or even our own feelings and what exactly to do with them. One strategy that can help to recognize sizes of our feelings is known as scaling. Scaling allows us to recognize where we are at on a scale. If I have someone come into session telling me they are feeling sad, I will better understand where they are at by gaining some perspective through scaling. I could say something like, I hear that you were feeling sad. If you could rate that on a 1 to 10 scale, 1 being the smallest and 10 being the most sad that you've ever felt, tell me where your sadness is. Through scaling, we can increase mindfulness and awareness into our feelings, develop emotional regulation, identify triggers, and to develop coping skills that are specific to the moment. Scaling can be used for any type of feeling, from anger to worry to sadness, or even just stress in general. As adults, I encourage everyone to check in with their own stress level using scaling. There are a lot of things causing stress over the last year, and if we can use scaling to check in with ourselves periodically, we may be able to better recognize and respond to our own needs. For example, if I make a habit of checking in with my own stress level and I start to recognize that I'm climbing the scale throughout the day or the week, it will be a signal that I need to take a step back or engage in some stress relieving activities myself. Depending on the age or development of the individual I am talking to, I use scaling in a few different ways. We can use a 1 to 10 numerical scale for adolescents to adults, a small, medium, big scale for children or early adolescents, or even a yellow, orange, and red scale for children. There are a few different visual aids that I use to help a child recognize and remember this concept. Some examples include a basic rectangle chart with 3 sections, a basic drawing of a stoplight, a picture of a volcano, or an elevator, and I often use thermometers. As I mentioned earlier, these visuals can be used for any feeling. The sample visuals I am showing are digitally created. However, I really encourage kids to help create their own visual through drawing and coloring. By creating a visual of their own, it helps them to have a sense of ownership and authenticity. It might even make them feel proud to hang it on their wall and be able to use it later. For today, in coaching scaling with our children, I will be using an example of an anger thermometer. With these scales, you can see that the smaller feelings are on the bottom, and as you move up the scale, the bigger the feeling becomes until you reach the top. If I use the example of an anger thermometer, you can see the small feeling is equivalent to frustration or annoyance, medium could be mad, and big could be enraged or furious. I often encourage kids or teens to identify the feelings words themselves, as well as working to develop an understanding of what each size of feeling it feels like. In using this tool with your own children, you can go through recognizing what each size of the feeling may look like. What do you notice when your child becomes frustrated? What nonverbal cues are they giving you when they are a medium-sized mad? If they reach enraged, how can you tell? Ask your child, what does it feel like in your body when you are a medium-sized mad? Working on this with children can help them to develop mindfulness and recognition of what feelings actually feel like. Recognizing them then gives them a sense of control. I encourage writing or drawing warning signs of what you notice in your body on the left side of the visual scales. So now you may wonder, why do I need to recognize what size my child's feeling is? This recognition helps inform us how we can help them in the moment. It is important to know how brain development is at play when it comes to feelings as well. The larger the feeling may become, the less in control a child may be. When a child reaches the top of their scale, so a 10 out of 10, the red zone, or the big feeling, their brain is dysregulated. Their thinking center of their brain in essence goes offline. They may not be able to necessarily hear or comprehend what you are saying in that moment. The ultimate goal at this time is to help them calm back down their scale and re-regulate before any logical thinking can happen. Think of it as an elevator. If you are on level 1, but your kid is on level 5, it is going to be really hard to communicate and be able to reach them. We need to work on bringing them back down to our level before we can do that. One strategy to remember as parents in this situation is to connect, then redirect. Once you are able to connect with a child, have them calm back down to your level, it will be easier to communicate and be able to redirect them. Another reason it is beneficial to recognize size of feelings is that each size of feeling may call for its own type of coping skill. For example, if coloring is a calming strategy for a child when they are frustrated, that strategy may not be as helpful if they are enraged. Then you might notice that some crayons or colored pencils get broken or even thrown. In using these scales and visuals, I help kids to recognize what coping skills are appropriate for each size of feeling. Once these are identified, they can be written or even drawn in pictures for the younger ages on the right side of the scale as a visual reminder or a type of coping skills plan. Although big feelings will continue to happen, the overall goal is to help ourselves and our children develop skills to catch the feeling before it reaches the top of the scale. Our coping strategies are useful tools in catching feelings and helping to move back down into calm. Coping strategies are unique to the individual based on their interests and overall what works for them. A few ideas for small to medium-sized feelings can be coloring, reading, using fidgets, listening to music, getting a snack or a drink of water, watching calming or funny videos, talking to a friend, or deep breathing. For big feelings, I often see people identifying a need to take a break, asking for a hug, cuddling with a blanket or a stuffy, or even for older kids using a meditation. It is important to note that experiencing ups and downs or meltdowns can be developmentally appropriate. If frequent or consistent meltdowns are occurring past the age of 4 or are occurring more than 3 times per day for 15 minutes or more, it may be helpful to talk to your primary care provider at South Lake Pediatrics regarding your concerns to assess a plan or potential treatment recommendations. In conclusion, scaling the size of our feelings can help to develop overall emotional regulation in our children. Emotional regulation is the ability to have appropriate responses or some control over feelings in order to develop a sort of stability or balance. Instead of riding the initial climbs and falls of a roller coaster over and over again, we start to have more middle ground with less drastic ups and downs. I often hear from parents that their kid goes from 0 to 60 or from calm to total meltdown. By helping parents and children recognize their feelings as they grow, a child will begin to develop recognition of how they are feeling, even the small and medium-sized feelings. Emotional regulation is a really important skill that children and teens continue to develop until their brain has matured. You are doing a good job just by being here and supporting and loving your children. Parenting is not easy. And by using scaling and recognizing our feelings, hopefully we can help to develop strategies for our children and for yourselves as parents that can help them as they continue to grow.